Hi, it's Dr. Centeno, and I'd like to talk about a really important thing today, and that is that we have concussion patients out there that don't seem to get better. So what could be causing that, and could it be coming from their neck? Now, before we get into this, I'd like you to like, comment, share, subscribe, because that's how we get this information to patients like you. So how many concussion patients also injure their neck? What does that look like? Well, this is 3 different studies that show that a lot of patients with concussion also injure their neck at the same time. And we know that the skull connects to the upper neck. So if you get trauma on your head, the next thing in line for injury is your upper neck. And we also know that the facet joints in your upper neck can get injured. Those are little joints in the neck. And that the ligaments that hold your head on can also get injured. Now, upper cervical symptoms are things like dizziness, imbalance, vertigo, headaches, cognitive impairment, brain fog, visual impairment. And that's really the same set of symptoms that many concussion patients have. And so the question is, are you in this crossover group? Is the reason why you're not getting better with standard concussion treatment because you injured your upper neck? And if so, are you on the wrong treatment track? And do you need to switch tracks to actually start getting better? And this is why I see a lot of the patients who I treat for craniocervical instability, that is injuries to the ligaments that hold the head on, who ultimately, once that gets treated, get better despite the fact that they had a concussion diagnosis. They were simply on the wrong track. They got on the right track. They got their upper neck diagnosed, and then we treat their upper neck and things start getting better. So if you've had a concussion and you still have symptoms, there are some things you should consider doing. Number 1 is get your upper neck checked, and that needs to be by a specific upper cervical specialist. The fact that your MRI is read as normal, regrettably, often doesn't mean that much. You're probably going to need different kinds of imaging. The top 2 upper neck diagnoses to consider would be an upper neck joint injury or ligament injury, as I've discussed. Ligament injury is called CCI, or craniocervical instability. The top conservative treatments that can help are generally very specific kinds of chiropractic, AO or NUCCA, or highly specific manual PT, which is generally a little harder to find. The top diagnostic imaging modalities include digital motion X-ray and upright flexion extension MRI. Again, we talked about those different kinds of imaging things that you might need. And then the top injection thing to consider is what we do, which is very precise injections into those damaged upper neck structures. And the most invasive thing that some people may need, but most don't, we try to help patients avoid that, is an upper neck fusion or other big surgery. So again, at the end of the day, in summary, concussion patients frequently injure their necks. When the neck is involved, the upper neck should be the focus, and we can treat the upper neck. That's the bottom line. So again, like, comment, share, and subscribe to get this information out to more people, and thanks so much for watching, and have a wonderful day.